question, is it in addition to systemic antibiotics? Is it instead? What's the dosing? Do you reduce the systemic? Just all kind of like a medicine application of it, if you don't mind.
Yeah. Yeah, of course. First of all, no, you're not, that wasn't stupid to do. That actually, a lot of the market research that was done for this product obviously was done with human orthopedic surgeons before they decided to go into veterinary medicine. And that is a common practice in human orthopedic surgery. Um, they were surprised, me and engineers, when they started talking to veterinarians, that more veterinarians don't do that, at least in North America. So you are not off base for having been taught to do that at all. But the limitations of anything, it was sprinkling antibiotic powders in there, antibiotic infusions, those things all have the potential. It's a one-time dose, right? And then anything where you have like other current opportunities now would be calcium sulfate impregnated beads or PMMA impregnated beads. Those have the same issue in that they're going to elute that drug in a very, relatively quick amount of time, and potentially could serve as a nidus or infection when they remain in the wound and no longer have antibiotic eluting from them. So, that's really what we're not reinventing the idea of putting antibiotics locally or directly into a wound. What this is really doing is allowing control for the veterinarian to say, not just when do I dose, but what do I dose with. For example, you go into a surgical site, you culture the site, you place the pouch, and you start dosing with one antibiotic, and your culture comes back and suggests you should change it. You have the flexibility to do that. So as far as replacing systemic, I mean, we are a local drug delivery device. So it's still up to the clinician to determine which antibiotics should be used. Most of the veterinarians we've talked to, they're going to rely on cultures if it's an already infected wound. If it's a preventative solution, then they can go with whatever they're accustomed to using. The only limitations with the device is that it has to be a water soluble antibiotic, and it has to be an antibiotic that's already approved for IM or sub-Q administration, because it's going to be dosed directly into the tissues. So the things we've dosed through it have been mostly aminoglycosides and lidocaine. So we have placed lidocaine in the pouch actually for prior to removal, which we've had plenty of patients that have had this used where they didn't do that prior to removal and the animals didn't react upon removal. But it does dose lidocaine effectively as well. So in theory, any small molecule that's water soluble, it's IM or sub-Q approved, in theory could elute through this membrane effectively and be dosed locally.